Good evening, welcome to First Aid for Families. I'm Sarah. How are you all this fine evening? It's a bit weird actually it's a bit dark, isn't it? It's getting darker now and I don't even feel like we've got into the summer yet. Hopefully we haven't had it all and this is going to be the cold period coming up, but hopefully not. Anyway, I'll just wait a little bit to see, sorry, let me just clear that off, see who's going to pop on. Hi Shelley, how are you? You alright? Hi Hannah, you're okay? Nice to see you here. Now tonight we're going to be talking about nosebleeds and I'll just wait for a few people to come on. But do any of you suffer with nosebleeds or children that suffer with nosebleeds? There's a bit of delay on this, so I'll put the question out and then we'll see. Because nosebleeds, especially in children, are quite common, and I know I suffered with them as a child, and and then it just stopped. So that was good. Anyway, so nosebleeds then. Right, most commonly occur. Shelley, your 9-year-old does. Yes, yeah. Hopefully he'll grow out of that one. It'd be interesting to see how often does he get nosebleeds, and is it a regular occurrence or is he bashing himself and causing a nosebleed? So the nosebleeds generally occur when tiny blood vessels inside the nose rupture, so all the time. So hopefully he does grow out of that. Well, with nosebleeds, we'll talk about the first aid for nosebleeds. Anyway, and things like that. But if you're finding that it is becoming more of a common occurrence, it's best to actually seek medical advice, because there could be an underlying, could be health issue. It could be chronic illness, like an allergy or something like that. So something that's causing the nose to bleed more than it should do, really, and often during the night as well. So Shelley here. Oh, okay. Yeah, so during the night, that's problematic as well, especially with young children, because I don't know if your 9-year-old, if they swallow it, it can induce vomiting as well, so it can be quite distressful for children. But it is worth, if they are having these nosebleeds quite often, seek medical attention, because there'll be something underlying, and it could just be an allergy. So again, have a look out for that. Most oftenly and most commonly within young children, it could be because they've hit their nose. We know how young kids are rough and tumble all the time. Sneezing can actually bring on a nosebleed when the small capillaries start rupturing. Picking the nose, young children are very prone to sticking their fingers up their noses and having a good old rummage around there. Again, that could cause it. And also down to nose blowing as well, especially young children, because they're not very good at blowing their nose. Try and teach them to blow their nose, and sometimes they can actually blow those blood vessels. All right. Older people, nosebleeds can occur because of high blood pressure or anticoagulants, which are clotting. That's not even a word. Anti-clotting medication. So again, if you've got people that are having frequent nosebleeds that are older, are on potential medication, then again it might be worth them going back to get advice from the doctors. Nosebleeds can be serious. Like head injuries, children hit their heads or adults hit their head, it bleeds an awful lot. It's the same with the nose. It can look like an awful lot of blood. So it's really important that we can stop that bleeding as quickly as possible. If the nosebleed is as a result of a head injury, the blood might appear thinner and watery. Okay, so that's quite a clear indication that potentially there could be some kind of head injury there. So again, that's what we're looking at. It could indicate a fracture of the skull, and the fluid is leaking from around the brain. So if it is thin and watery, then again, the best thing to do there is just to ring 999 and get medical help. Okay, right, what to do? I see this all the time in my first aid courses, the first thing that people want to do is to pinch the nose and then sit back, because sitting back, they feel that it's going to stop the bleed. We don't want to do that, because as I said earlier on, with young children, if they have nosebleeds at night, they're lying back, it goes down their throat, and it can cause vomiting and things like that. So we need to pinch the soft part of the nose, not going to be able to speak properly now, okay, and just tilt the head forward slightly and ask them to breathe through their nose. Very young children, it can be quite distressful, so get a bowl, so lean them forward, and then you pinch their nose, lean them forward, and just reassurance with them there. Now we need to pinch that soft part of the nose for at least 10 minutes, so keep it nice and tight there for 10 minutes. Advise the casualty not to speak, best not to put any pressure around there, swallow, cough, spit, sniff, definitely not, because it might upset the blood clotting process and it might just start again. Obviously give them a tissue if you can. An adult, they can do that themselves. For a child, you'll have to do it for them. After 10 minutes, ask the casualty to release the pressure, or you do that. If the bleeding has not stopped after that time, then you're going to reapply pressure. You can do that up to 3 times. All right, so it's a 30-minute process. So 3 times of 10 minutes, and then hopefully by that time the bleeding has stopped. If it hasn't, then again we want to make sure that something more serious isn't going on there. So it'll be a good idea after 30 minutes time, that's a serious bleed, they're now losing a lot of blood there, take or send the casualty to hospital, because we don't want them to go into shock. So hypovolemic shock when we're losing fluids there. All right. If the bleeding stops, brilliant. Then keep the casualty to lean forward, clean their nose, lukewarm water, and tell them to rest for a few hours and try not to blow their nose, because they don't want to kind of restart that. Okay. Katie, lean forward or backwards? Yep, so leaning forwards. All right, slightly forward, pinching the nose there for up to 10 minutes, and do that 3 times. Okay. When we're looking at, I think Shelley asked the question earlier on about how often, if a nosebleed is happening quite often, how often that would be. You're looking around reoccurrence of 2 to 3 times a month, so that's quite a lot of reoccurrence for nosebleeds. So again, we might want to get some medical attention there. Other times that you seek medical attention for nosebleeds, so if that person's been involved with a car crash or an accident involving greater than expected blood, so it's not stopping bleeding. If it's interfering with their breathing, again, seek medical advice there, ring 999. Lasts longer than the 30 minutes, as we said, even with compressions, and then occurs in children under the age of 2. So really young children, it might be wise just to seek medical attention there. Okay. So anyone suffered nosebleeds apart from children? As an adult, any of you suffer from it? It's normally quite rare unless they're on got high blood pressure or on blood thinning medication and things like that. Someone asked me earlier on about broken noses. An indication of a broken nose. It could be very loose, crunching sound, really grim, and potentially blackening under the eyes there. So again, with a broken nose, you might not be able to put that direct pressure on it. If you can, then put the direct pressure onto the nose, pinch the nose for about 15 minutes. Most broken noses, they do mend themselves, after a bit of care. But the best thing to do is to put an ice pack on the nose, wrap it in a tea towel, and put the ice pack on there for 15 minutes several times a day, because you want to reduce that swelling. Paracetamol and ibuprofen. If they are bleeding from the nose, sit or stand them upright, leaning forward, and if possible, pinch that nose for 15 minutes. If obviously they want to go to bed at night and they've still got that broken nose, hopefully it's not bleeding at that point, but the best thing to do is try and keep that person sitting as upright as possible in bed, If there's any problems, then obviously just seek medical attention as quickly as you can. Yeah, I think one thing I would say is don't try and straighten a broken nose on your own. I don't think anyone would want to do that. There'd be quite a few crunching going on there. Okay. So Shelley, you said when you were pregnant, so maybe that would be down to blood pressure as well. Okay. Now, has anyone got any questions? I'll give it a couple of minutes. If not on nosebleeds, but on anything else. Of course, if you think of anything during the week, then just put it in the comments below and I can get back to you and hopefully answer those for you. Thank you for everyone that took part in the poll as well this week. I think obviously we're doing nosebleeds tonight. We'll do fractures next week and we'll do swallowed poisons, I think, the following week. But as I said, if there's anything throughout the week you want to learn about, then obviously just give me a shout. But if you haven't got any other questions, I don't think there are. Let's just have a look. No more questions. Then I'll say goodnight and I hope you have a lovely week and I will see you this time next week. All right, take care. Thank you. Bye.